Isn't that true? Don't give a horrible person a break because it will just keep getting worse and worse, and it'll take more and more. So you just have to don't let him ride at all. Don't let him ride in your car. That's Lurie Bell, bluesman Lurie Bell, with Reverend Gary Davis's gospel blues tune, Don't Let the Devil Ride. This is from Lurie Bell's 2012 CD, The Devil Ain't Got No Music. I think, I don't think we could argue with that. The devil ain't got no music. This is Leid Stories. I'm Utrice Leid, and welcome to the start of the week. Although it is about, sharing news about our current situation, which isn't all that promising right now. It is not all that appealing right now. We have a president who is out of his mind, and several of his sycophants and acolytes doing their best to destroy the one little glimmer of hope that we have, which is that there might be, I think we spotted quite a few in his administration who were trying to do the right thing, trying to put the nation on course. But the first subject I want to start off with, which is related, is about people's behavior. It's as if the country is going mad. Time and again, and it seems especially after reports of high death tolls and new cases of coronavirus, we see people by the hundreds and the thousands engaging in very risky behavior as if daring the virus to infect them. What could possibly be the explanation for this? I mean, we see it on the television, as we saw in the last holiday or just this past weekend. People packing the beaches and the lakes and whatever else were up. I mean, they're jam-packed right next to each other. Instinct alone should tell them that that is a stupid thing to do. But they're doing it. And they're bringing their children along. You know we're in the middle of a pandemic. And by the way, the United States is at the top of the list of countries where it has gotten so out of hand. More than 135,000 people have died, more than 3 million infected. Do you need anybody to break that down to you as to what that means about being careful in the way you conduct yourself so that it minimizes? It may not completely prevent, but it surely will minimize the instance of you catching this virus. But you see those aerial shots that the news people are showing us at beaches and lakes and other areas where people congregate for picnicking and so forth, jam-packed. I mean, there is no breathing room because the people are so close. And here's the other part, which turned me off instantly. Just seeing that many people occupying such a small space in a body of water. You know what that tells me. There are people peeing in it, spitting in it, and doing all other kinds of very unattractive things in it. And the people are just there. They won't listen to the cautions that are given. That's not the best way to go. That's not the right thing to do. And you have your children in the middle of all of that. all to say you are having a good time. Your brain has taken a leave of absence, and you're functioning like an automaton, I don't know what to say. And then we will learn some weeks later, or maybe even sooner than that there's a spike in the coronavirus rates. Well, hello. It's to be expected when your behavior brings it on. Do you have to go to a lake and, rub up against, literally, there's this little tiny bit of space. Forget the 6 feet. These people are on top of each other in bodies of water or on the sand or wherever it is they're laying out to supposedly have a good time. They're breathing next to each other. Nobody's wearing a mask because these are Trump people. Trump people are not mask people. And in the meantime, you have these kinds of statistics staring us in the face. 135,000 people. We lead the world in coronavirus deaths and infections. Isn't that a great accomplishment? And still, people are not even bothered about it. Way too many people are not bothered about it. They're doing what they want to do. Their attitude is, if I get sick, well, I'll go to the hospital. But what are we learning? We're learning that the hospitals themselves are nearing capacity. They can't cope with the coronavirus cases coming to them. So pretty soon, it is possible you have to revert to tents or some kind of makeshift accommodation to accommodate these people who are too stupid and self-destructive to just exercise caution. So I think, maybe it would come to a point where as these people congregate with each other in various venues, that they should understand, should they come down with this virus, they're on their own. Figure it out yourself. We should have no responsibility for people this reckless, this careless, this in your face about, I will do what I want when I want. I don't care about the consequences. Now, the consequences will be your problem. We have to send a message very early that, no, this is your problem. Let's say you had intended to go to the lake to hang out for the day with your family. Okay, you get there, and even before you get there, you see signs that you shouldn't be there. Traffic, people waiting in line, you can't find parking. All the indications that you are in the wrong place. And let's just say you put up with all of that and you get to the lake shore and you see people literally so jam-packed in the lake that they're on top of each other. Wouldn't your brain send out alarms that no question you're in the wrong place and you should do everything you can to get the hell out of there as soon as possible? But no. These are the Trumpites. You can't tell me what to do. You can't make me wear a mask. You can't make me observe all the protocols that Dr. Fauci and others have been trying to tell the nation, there is no guarantee you won't get this disease, but there is much less of a likelihood if you observe certain protocols. You're not going to be in a tightly packed situation. You're not going to find yourself hanging out all day in that situation with hundreds of other people and thousands of other people. You're insane. But that is a very interesting American attitude. I can do what I want, when I want, how I want. You can't tell me what to do. Okay. So then find your own hospital. But it does irritate me that media people think that they must stay on this as big news. This is big, big news. And they have a duty to report it. I'm not interested. Trump wants to wear a mask. Hip, hip, hooray. I wear a mask because that makes sense to me. That's logical. It is not perhaps the top of the line response, but it is a very effective response from what we are told, from what I have read, from what other nations have experienced. Wear a mask, reduce as significantly as you possibly can the incidence of your infection. So why do I care to make such a big deal about Donald Trump wearing a mask? You want to wear it, you wear it. Okay, so I should let you know something. It's a good news in a way, but we will suffer a little bit in terms of hiccups now and then because they're doing a lot of technical work that we can't see, but we certainly might experience in the next couple of days. So bear with us, and we will be all right. The new equipment is being installed, and at the same time, they're trying to manage programs that are ongoing. But, this is the beauty of people who know what they're doing. Don't ask me to handle that. That is not my department. My department is talking and encouraging you to talk. But technically, I'm a dud. So please bear with us as we upgrade over the next few days. All right, question to you. When President Trump was pushing this anti-malarial drug, hydroxychloroquine, as a game changer in the battle against coronavirus, in fact, he even offered his own testimonials about what a great thing this is. It will do so much good. It will get rid of the coronavirus and help people to treat the disease if they have it. While he was doing all of that, reports have surfaced that there were at least 63 million doses of hydroxychloroquine already in the federal stockpile, even though leading medical experts and research had shown the drug to have no helpful effect on people with the virus. My question to you, do you smell a rat? At 888-874-4888. 888-874-4888. Do you smell a rat? I'm smelling it all the way here. It's a really foul smell. But I want to know if you're smelling it. 4888. This is the kind of president we're dealing with here. Okay. First call we get, first call goes on the air. 888-874-4888. I want to move on to other subjects, but this is a really important question. I'd like to know, as the president is touting this new drug and what a wonder it is and will be when Americans use it, 63 million doses had been ordered and were stockpiled in the federal storage areas. But it smells funny. It smells unusual. LJ from Utica, you're on the air.
Oh, hi, good afternoon, you trees.
Hello.
Yeah, I just wanted to share some thoughts on the COVID stuff. I've been following this closely for a while. Been listening to alternative media, a lot of progressive insight on it, and of course, Gary Knowles' show. He has a lot of people on, scholars and so on, presenting their viewpoint from it. And I'm kind of like I'm right in the middle as far as what's going on here. I think there's a lot of confusion with the COVID stuff. I think the fear and panic has messed things up considerably. As far as the contagious, do you believe that COVID-19 is one of the most contagious viruses out there?
It may not be one of the most contagious, but I don't know that there's a contest as to what's more the most contagious of anything. It is contagious. That's all we need to know. It's contagious. It's killed more than 100,000 Americans so far. What are we waiting for? What is the magic number that would satisfy Americans? We've had more than 3 million people infected. 135,000 have died. What more do we need to at least, to just say, this is a serious situation, I better pay attention to it?
Well, let's look at the numbers just for a second. As far as flu cases, and a flu serious, upwards of 650,000 people die a year worldwide. And 1 billion, that's with a B, catch the flu every year worldwide. So that's a pretty serious number. And if you look at that compared to COVID, 10 million, that's 100 to 1.
Yeah, but you see, you're playing numbers games. I'm not. If 10 people should get a very, very serious disease that has the potential of being even more devastating when it spreads, that should be of concern.
Don't tell me, germaphobe.
And when I go to the flu, and then people get dysentery, and then people get stomach reflux, acid reflux, it means the numbers speak for themselves. This is an impressive number because what? It puts the United States at the top of the list, along with Brazil, along with the United Kingdom, of the ravages of coronavirus, and it continues to spread as it mutates. This is a major health hazard by any definition.
All right. Well, just for U.S. numbers, 45 million people get the flu every year, and about 60,000 die.
Don't tell me about the flu, because the flu is not the same thing.
All right, just let me mention a couple other eye-raising thoughts as far as hospitals. When, they get several $1,000s for every COVID-19 patient, and then for every COVID-19 patient they put on a ventilator, they get $39,000. That's a little disconcerting right there. I'm not saying every hospital out there is corrupt. You look at the health workers that were panicking about putting people on BiPAC or CPAC instead of right to And what they're doing is putting them straight on ventilators because it's a closed system. So there's very little.
Yeah, but you took us off. You did take us off, and I'm indulging you. You took us off topic. You took us off topic.
Let's go back to the masks.
Okay. No. Let's not do the math, because that is a convenient counterfoil. The issue is, at some point, we have to look at the numbers differently. Even if you had 100 people with a really awful disease, and you don't know where it's coming from, you don't know how to treat it, you don't know where it's happening next, and to what effect. This is a matter of public health. When the experts are saying, don't joke around with this, don't play games with this could wipe you out.
Yeah, but it's the mainstream experts that we're listening to on regular corporate media. And what about the alternative doctors? What about the hundreds of scholars?
I'm not interested in that. It's not. I'm not interested in how the media choose to cover. Whether you're hearing from the alternative media, that's not the issue. The issue is that people are dying and have been dying and will continue to die. The issue is that we have a crisis on our hands. That's the issue.
All right. That's where we differ. The comorbidities is an issue, which I'm sure you heard a million times. People who are, dying. We got 233,000 people dying every month from all causes. 600,000 people dying every year from heart disease.
You keep going back to a point that is, for the purposes of our discussion, not relevant. You keep going back to that.
You're saying
400 million people die because of, infection. Okay, well, that's one thing. We're talking about this disease.
Yeah, but
we're talking about the impact it has had so far.
But you're talking about the death numbers and how serious. What are those death numbers? Something else is comorbidities. So we're having 80% of these COVID deaths that are actually comorbididities that are claimed COVID. So it's inflating the numbers.
Right. When you want to get into the details of what's comorbidity, that's a whole different subject. I am strictly saying, let's deal with the facts a little bit differently. Because Americans find all kinds of ways to argue an issue except to deal with the issue.
Okay, and on
you have not yet answered the question about what are you doing with 135,000 people dead, and the attitude in this country is, hope they had a good life before they went. We don't. Right. We're not discussing these 135,000 people as people who headed families, people who were part of communities, people who had jobs, no longer having jobs, and nobody could get those jobs that they used to have. We have a lot of complicated factors here in that one statistic.
But you're suggesting that because it's a communicable disease and we all have the chance to prevent it, that's why these, deaths are important as opposed to the 2.8 million people die from all other causes?
Everybody dying from any particular cause that is preventable should concern us. Everybody.
Okay, because there's 80 communicable diseases out there. And,
but you're going off on a tangent again. When does it stop? When do you stop and say, let's deal with this? Let's deal with this.
Because you're making it only the 130,000 dying this
because
year.
I am discussing in specific terms the impact of the coronavirus. I'm not discussing, as I said, I'm not discussing acid reflux. I'm not discussing stroke. I'm not discussing cancer. I'm not discussing any of those.
All right, because now people are fearing because this is apparently has an immediate consequence. All other things that have a consequence that happens down the line, people don't care too much about. But being that everyone's walking around the street in fear that they can
But
catch
you
this
are
disease.
wrong. You are wrong again, because it is not about. You seem to know what everybody's thinking.
No, it's just an alternative viewpoint that I'm trying to present, especially after you listen to the program that preceded yours. Gary Knowles, it's a whole bunch of different information. And,
yes, but it's a whole different view. I am saying, let's deal with this. As I started the program saying, we see the distressing evidence. Every time we turn on the news and it's a holiday or people packing the breach, we see people violating the heck, even to their own detriment, with rotten behavior. And they still insist it's somebody else's fault. If they get
but you know what's screwy about that, too? We listen to what the government tells us, and then you walk down Fifth Avenue in Brooklyn, and you see hundreds of people sitting down at the restaurant with no mask on, eating as if it's not contagious.
Fine, but you see, here's the thing. Nobody's enforcing it. And nobody is exercising proper self-control. Those people who are eating on the sidewalk know what the rules are. They're grown people. You take your child to the lake and the child is right next to somebody's butt in the water that is polluted because people are peeing in it, and that's okay with you? Come on.
I'm just saying how screwy how it's, as Simon says, like, if we're going to do the mask thing, let's stop with this eating out in public with no mask. That's what I'm saying. It's just odd.
There is no way of having a straight conversation with you, because every time you point something out, you dodge and you go someplace else. And I'm supposed to follow you and argue that point. I'm not going to do that.
All right.
This is the point that I am making. I am making the point that it seems as if this administration doesn't have an answer or methodology of coping with this disease. The advice that has been given from the experts that he has, he's now actually openly turning against those people and degrading them.
That I agree. And I'm
well, there we go. That's what we have. We've got
a progressive mindset, because sometimes when people come with this alternative view, all of a sudden they're labeled as a Trump or a right-winger, and I'm definitely not. I think he's a complete buffoon, and we need some leadership.
Yes, and we have a buffoon, but the buffoon is in charge, and the buffoon is influencing the thoughts and the actions of a whole bunch of other people who don't mind being buffoons themselves. The consequence is we have had 135,000. We are at the top of the list, this modern country, this very, very influential country. This is how we are leading the world now, by the number of coronavirus deaths and infections. And a president who insists that the big problem is that he doesn't want personally to wear a mask. This is where we are.
Yeah, people in leadership positions should. And by the way, everywhere I do honor the wear the mask, when I go inside, a close to public thing too. I'm not going to be a complete jerk and say, forget this mask stuff.
You're just going to be a partial jerk, not a complete one.
Yes, am I.
Look, I enjoyed talking with you, but I do wish that we keep our eyes fixed on this issue, because we are all being bamboozled. And it couldn't be worse that at the expense of people losing their lives, this administration is lying every day, every minute of the day, about what is happening. People are dying. People are becoming more and more infected. We have fewer and fewer hospitals able to treat. This is a serious crisis. This is not a joke. And we need to get some kind of gumption and say, we're not going to do this. We're not going to let our fellow Americans suffer and die this way. And we're not going to risk for ourselves and our families that we should die this way. That's what we ought to do. We ought to stand up and fight. Thanks for calling, LJ. Ed from Jamaica, you're on the air. Ed, you're on the air.
Hello, Patrice.
Hello, Ed. How you doing? What do you make of this?
I mean, I don't know why you're surprised. I mean, there's a prevailing, it's my opinion, there's a prevailing sentiment going around this country of just ignorance. And it's not even, I wouldn't even qualify as stupidity, it's ignorance. I mean, it's obvious there's whatever you want to call it, it's obvious there's some type of virus pandemic going around the world. And if there's some simple, rudimentary precautions that you should take and you're resisting them on some type of political stand or some type of ego stand or some type of, false freedom of right stand, you're an idiot. I mean, put on a mask. What's the big deal? Stay away from people. Until, is there a lot of confusion with this? No doubt. And are there people, as in the title of Naomi Klein's book, Vulture Capitalism, is that going on? Yes. And after everything is said and done, if we do have some type of morals or some type of proper leadership to come out of all of this, there needs to be a heavy investigation as to where the funds went, who made money, and who didn't make money. So that being said, in the interim, err on the side of caution. What's the big deal? Put a mask on, stay away from people, and wait and see what happens. I mean, whether 1 billion people die from the flu or whether 135,000 people die from this or from that, I don't want to die. I want to die from old age. I don't want to die. I don't want to die from stupidity. I got no problem. Put on a mask, stay away from people, and put your pride in your pocket because your pride ain't gonna get you nowhere but the grave.
Do you have any thoughts about the fact that all this money was spent to put 630 million doses of hydroxychloroquine in a stockpile? The same hydroxychloroquine that Donald Trump was touting as the game changer in the battle against COVID-19.
Well, you know who you're dealing with. I mean, you're dealing with the ultimate La Cosa Nostra. You're dealing with a gangster. And he's got some type of monetary interest in it, whether it be directly or indirectly through one of his children or one of his partners or one of his cronies or Robert Stone, whatever. I mean, like I said, after all of this has died down, which it will because these things run a course. If you look at history, the Spanish flu, even the Black Plague, it all runs a course. And eventually we come to some type of modicum. A vaccine is developed, herd immunity, whatever you want to call it. Someone needs to say, look, what happened here? There were billions of dollars spent. There were billions. There were faults in the healthcare system. There were faults in the allocation of funds. There were faults in the mobilization of government. Who did what? And let's hold some people accountable. Let's put some people in jail.
Yeah, because here we have, even as he announced it, it was already said that hydroxychloroquine is ineffective in the treatment of the coronavirus. So how does Trump end up being the champion of an ineffective drug? 63 million doses in a stockpile, in a federal stockpile somewhere. This drug was used to treat malaria. And we have inspectors general. Their job is to go and investigate. Nobody's investigating this.
We're letting it happen. You could get. Everybody's out here protesting. There's all this sound and fury, but you're cutting off your nose to spite your face. Look what's going on right in front of you. Look at that. A drug that is for malaria that experts in other fields have said is ineffective and causes complications, anywhere from respiratory complications to cardiac complications, is being stockpiled by this government. Who's getting the money for that stockpile? Who's manufacturing this drug? Who's tied into what? I don't know.
And who is the big salesman? None other than the President of the United States has taken on the role of salesman for this drug. Seems to me there ought to be an investigation.
Should be countless investigations.
I'm telling you. Thanks so much for calling in today and contributing. E from Edgewater, you're on the air.
Hello, Utrice.
Hello, E. How are you doing?
I'm hanging in there.
Good.
Yeah. It occurs to me that when there's something like this, we should go to the experts. Now, every year, people graduate from first-class universities, medical schools. Every year, people go to school to learn about different medical procedures. They want to be a virus expert. So they go to school for 8 years and study nothing but viruses. And then they graduate and they get jobs in laboratories or big companies and work for the government to do nothing but study viruses. And for the last 100 years, people have had their whole careers doing nothing. Every day going to the laboratory and doing nothing but studying viruses, how they react, how they act, how they do this. And all we can come up with all these thousands and thousands of people that have gone to these reputable, spent hundreds of thousands of dollars on their education to study viruses, and all we can come up with is wear a mask and stay 6 feet apart. Something is not right here.
But that's not all they came up with. To be fair, let's be fair. That's not all they came up with, and they weren't the ones to just say, well, this is the solution. Not at all. They continue to study the virus all over the world. People are working in cooperation with each other, exchanging information that they have acquired and information that they have researched. They're working very cooperatively. They have a clear interest in doing so because this is a global pandemic. However, you have to realize something. Viruses behave differently from any other organisms. You can study a virus and you think you have a handle on it today. By the end of the week, there's something new, which is the case with the coronavirus. The coronavirus that they began studying when it was said to have emerged from Wuhan is not the coronavirus that we're talking about today. And there's a new generation of virus that they're now studying because they discovered, or it has been discovered, that the virus is now spread through the air. Before it used to be spread one way, now it's a whole new way, so they have to catch up with the very fast changing nature of the virus. Because when the virus changes, it means the mode of treatment, the modality of treatment also will have to change. This is the frustration with the coronavirus. It is outwitting and beating all of the predictions based on old research. The research they did just a year ago, in many cases, they have to start again because there is a kind of new virus and it will continue to mutate. They can't keep up. This is the issue.
All right,
it is not the same coronavirus.
Here's a point. You said earlier in the show that you wear a mask because it's logical to you. It's logical and it makes sense to wear a mask because they're telling us that this is our protection from it. Now, I agree with you on that. But there's some people out there that have asthma and other respiratory problems that they are unable to have a mask covering their nose and mouth because it makes it impossible for them to breathe correctly. Now, to me, a more logical, sensible thing would be to make the face shield the mandatory thing, where the shield's covering your face, but it's not right up against your mouth and nose. So there's a little space where you can still breathe air. And this way, you're still protected,
the question
and
is
it's easier to clean off. Because when you're done using it, you just wipe the inside and the outside, and it's ready to go.
Yeah, but you think that's how the virus behaves. You're thinking the virus behaves that way. It doesn't.
No, I'm not thinking anything about the virus. I'm thinking
an invisible
that the
enemy.
shield makes more sense than a mask. Because then the people
no, it doesn't necessarily.
It still be protected with the shield. You understand
where
I'm coming from?
But it does not necessarily make more sense. It's just different. It does not necessarily make more sense.
Yeah, but they're not even giving people that option of a sensible reasoning like I just gave you. People can't have covered their mouths and noses because they have asthma and other problems. So
yes, but they also have. But you have to listen for a minute. The fact is that all these different areas that you're talking about, they're all evolving. Right now, there's no perfect mask. There's no perfect shield because under the shield, the air can still come into the person's nostrils and mouth from under the shield. It's a thing that evolves. The more they understand what is happening, the more that they can change things.
So what are we all going to be like people that have COPD and have oxygen masks with tanks on our backs?
You're being dramatic. You're being over dramatic. I have cancer, as you know. I said it. It's not easy for me to be out. But in my own way, I have found or fashioned a way to be out and to be able to breathe reasonably well.
Yes, but you went to the doctor and he told you to go home and plan your funeral because there's hope. And you went to Gary Null, and I'm sure Gary Null didn't give you a vaccine to cure you. He gave you a regimen of faith.
I also have two doctors in my family. Apart from
for us with this virus.
Give me a minute, if you don't mind, to let me get. No, there are two doctors in my family as well. So I'm not without the resources or availability to medical treatment and advice. What I'm saying is, just the same, I rely first and foremost on me. I'm the one experiencing this. And I have to be somehow in charge of that. But that's a patient's decision. Things are changing very fast in the coronavirus world. And industries can't keep up with it. The changes that are occurring are mostly, literally, day by day. What was working 2 weeks ago may not be working now or may not be as efficient now. That's the difficulty of the period we are in. People are expecting answers, definitive answers about a virus. virology is a whole different study. A virus that is a virus today is not the same virus that you will be dealing with next week. And you will have to know, or you should try to know, in what ways can you make adjustments? Because, in what ways has the virus changed, and in what ways do you make adjustments? This is what's happening all over the world. It's not unique to the United States. This is the nature of viruses. And viruses at this level, when you're talking pandemic, you're talking global. And they can't even begin to talk with each other fast enough, exchange information fast enough, make adjustments fast enough to outpace the changes of this virus. That's what people don't understand. There's no set answer. There are some set things that we could accept, like you cover your face. That does help minimize the invasion by the virus into your body. It does help, which is why I always wear a mask. There's no problem there. But beyond that, I have no idea in what structural ways this virus has changed from last week to this week. So we're all marking time in that case. There are treatments that would help regardless, treatments that help you boost your immunity, boost your system, and so forth. All that would be fine. But really, we cannot keep pace. It would be misleading to think that medicine can keep pace with the pace of the changing nature of this virus. That is not going to happen anytime soon. That is the dilemma. I wish somebody
all I
had
know
the
is
answer.
if there's things out there like vitamin C, vitamin D, I want to know that's going to protect me.
But that was there all the time. It doesn't. Vitamin C, vitamin D, vitamin A.
Most
all
people
these,
don't
they
know
were there
about
all the
it.
time.
Just because you have a friend named Gary No doesn't mean everybody has a friend named Gary No.
No, but you have a library.
What about all the people that
go
got
and
told
read,
to go home and plan their funeral, and they didn't know Gary No, so they went home and planned their funeral, and now they're gone. You're still here because you listened to an expert who knows about these things.
Gary would
so
tell
we
you
should
very
be
much. Gary would tell you. Gary and my brothers and my brother. You can't talk over me all the time. Give me some room. Let me just say this. A lot of what you were saying is unfortunate because it's wrong. You can ask Gary. Gary gave me pointers on what to do. And then I was on my own. I took it on my own with his guidance and with my brother's guidance. I have a nephew who is a cancer specialist. But I also depend on my own. I go to the library. I'm constantly reading. I'm constantly doing my own research. I'm not just sitting there waiting for people to tell me what to do. And still, I must acknowledge that when we are dealing with a virus, no matter what you do, you have to start from the point of view of realizing that you constantly are chasing a monster. You constantly are, because it changes all the time. Right now, by the end of the day, a change might have occurred that would require major medical response. This is why we are in such a bind and why we have to be so careful so as not to encourage the spread of the virus through our careless conduct and behavior. We've come to the end of our program today. I want to thank you all for calling in. We still have so much more to discuss on the issue. So with your permission, we'll continue tomorrow on the same topic. Thanks so much for listening. Bye-bye.